My segment is IT and business operations, which is always a very exciting topic. But I think it's a very important one and becoming more and more important every day, not just to physicians, but to really to any business out there. My goal is not really to get up here and explain to anyone how to reprogram their firewall or write a new AHR software package. It's basically just to cover the role of IT in the business. What I came up with is find a balance between the cost, compliance, and your productivity. I mean, technology can make your business very, very productive. You can double your productivity with the same staff, for example, but in many cases, no one does anything because there's too many options. They don't clearly understand the options. They're afraid of change. There are people on the staff that may not buy into this technology, but it's there. And as we've seen with the advent of the EHRs, it's becoming something that's very central to a doctor's practice. Can go for it. One of the things that my sales reps do is one of the little tricks that they use when they walk into a doctor's practice is they'll pull out their cell phone, and while they're sitting in the waiting room, they'll see if they can get on the doctor's network. And about 60% of the time, they can. So to me, that's kind of an idea. That's kind of one of my little themes of, okay, what does your office have in place in terms of equipment? How is it set up? And how can you at least understand what is available out there or what can happen out there and then try to prevent it? We see a lot of networks that are administered by, someone's brother or someone's friend's friend that does computers on the weekend. And what ends up happening then is the technologies advance so quickly. iPads, how long have they been around? A couple of years. Phones, cell phones, being able to get on the network. These are all new technologies, and it's changing all the time. And there's really a complete lack of understanding among people, especially even my age group, as to what my kids can do with their cell phone. On a separate note, another portion of what I need to cover under my presentation is electronic health records. Now, some people have them in place, some people are looking at them, some people are doing everything they can to avoid them, and they're coming, they're here. So we're going to cover a little bit of what this can do for your practice, the definition of the meaningful use status, and how that's going to apply to getting your funds back. And then more importantly for my segment is how are we going to manage, maintain, and secure the information that's in your EHR as well as the network on which it runs, because as I mentioned earlier, in many cases that's wide open. What I touched on here in this, again, is as I alluded to in the beginning of the presentation, IT has become kind of a central part of every operation within the practice, whether it's your day-to-day operations, your EHR, your scheduling, your coding, your billing, the patient care. Patients are wanting to be able to get online and see their records, schedule appointments. The doctors themselves are using the software to provide a better quality of care. And then you have the compliance issues, which my colleague here will spend more time on, but from my standpoint, the security that's in place to protect all that information that's there. And I think that's it. That's just my background.
It's on the website as well.
I'm sorry?
It's on the website as well.
Yes, okay, which is on the website. Background in accounting, somehow ended up in IT, and now I'm here. But thank you.